today I'm here to talk to you about the 5 types of dental filling materials. Hey guys, I'm Dr. Jaclyn from Dental Designs Clinic in Singapore. I'm a general dentist, so let's talk about these 5 different materials and their applications in dentistry today. So the first category would be metal-based filling materials. So these will include things like amalgam or like gold. And the other big category of filling materials would be tooth-colored materials. So these are composite, which is basically a plastic type of filling, glass ionomer, which looks similar to composite but it behaves more like a cement, and then the last would be ceramic, which is porcelain. So amalgam fillings are basically a mixture of different metals. So those metals include tin, zinc and copper, but they are actually dissolved in a liquid mercury solution because mercury is like a solvent that can dissolve like different metals inside. The other type of metallic material that we can use is gold, and believe it or not, gold is still a valid choice of material, but with the cost of gold as it is now, it's really expensive to have a gold filling. If you were to ask me like what is the most durable dental material that we have to date, gold would still be the most durable because it doesn't break, it doesn't chip. In fact, it actually adapts and molds itself to the bite of the patient. So we have like patients who are maybe in their 80s and they've had gold fillings placed, maybe 50 years ago, and they still look just as good as new. So now that we're done talking about the metal-based materials, we can talk about the tooth-colored material. So it's just useful to think of composite as a reinforced kind of plastic material. So it's soft and malleable until we cure it with a light. So curing just means hardening. So again, for the ladies, like if you get gel nails done, it's essentially the same kind of material. The advantage of composite is that we can customize the shape of the filling to fit your tooth. It comes in like many different colors. So for example, if you're getting a filling on the front tooth, like we want to match the filling to the rest of the tooth, so you can get a really nice like glossy polish which helps the material to resist stain. This is the material that is used for, I would say, like 90 or 95% of the fillings that I do. And it's quite suitable for like smaller cavities. Like if, for example, the patient has a tooth that has been filled before and there's a problem with the existing filling or with the tooth, maybe there's a crack or there's some new decay, sometimes a composite filling will not be suitable just because of the amount of structural damage that has occurred. So bear in mind that composite is just a plastic. So where we are dealing with a tooth that needs like a lot more structural reinforcement, or essentially larger parts of the tooth need to be replaced, then my preferred would be some kind of ceramic. So ceramic and composite, when they're new, they can look almost identical because they're all like shiny and very smooth, but the difference rather comes over the long term. Ceramics, because they are glazed and they are fired in oven, like 700 degrees Celsius, they retain that shine and they are a lot harder in terms of materials compared to composite. So for that reason, if we are dealing with a much larger cavity, then a ceramic material would be more appropriate and it would last a lot longer as well. And the last of the tooth-colored materials is glass ionomer. Essentially, glass ionomer is more like a cement. So it cannot be polished to that same level of shine as a composite. There are some benefits, like it does release fluoride, but in the process of releasing the fluoride, the filling itself dissolves, so it kind of disappears. So I usually use it as a temporary kind of filling material. For example, if I've done a root canal, but again, the question of which is appropriate for you, it depends on the individual tooth and the patient as well. So if you want to find out more like about these different materials, like which would be suitable for your case, then I would always encourage you to work with your dentist, because your dentist will know, what's going on in your mouth, and also be able to advise you based on like your goals and your budget. So here at Dental Designs, we actually have an in-house lab, which is nice. So we have like our dedicated technicians who will work on like a ceramic filling and have it like custom designed for you and finished usually on the same day. So if you'd like to find out more about different kinds of filling materials that we have available, I would encourage you to visit our website, which is dentaldesigns.com.sg, for more information. And I hope to see you in the next video. Bye!